There's a great alternative to traditional nursing homes. Homewatch Home Care and Elder Care Options has a broad spectrum of long-term care options. Joining us now are Homewatch registered nurse Judy Ofas and Homewatch Home Care client Libby Erickson. Welcome to both of you.
Thank you.
Judy, I'm going to start with you. Tell me a little bit about how home care fits into this range of options that are available to people like me.
Well, many people believe that the only option is a nursing home when people need assistance with their daily cares. And actually, home care is a wonderful option. They can stay in an environment they're familiar with and get a customized level of care that's given on a one-to-one basis.
Tell me a little more about the services that are available and how the whole operation works.
Well, a registered nurse will meet with a potential client or an individual and their family, if necessary, to discuss all of their needs, physical, medical, social, emotional, and then the care is delivered by a certified home health aide on a one-to-one basis.
Now, there's, like we were talking about, a lot of different things that can happen because you can get someone to come in, we were mentioning just for respite care,
yes,
to give a traditional, a regular family member a break for the weekend, a break for the afternoon, all the way up to 24-hour care?
Yes, you can purchase services as infrequently as twice a week for 3 hours, or on a daily basis, or an occasional weekend, or you can have a live-in caregiver that provides care around the clock. It's a nice safety, security measure where families know that someone's there with their loved one.
Okay. Now, here are some of the specific services that you provide. Address some of those for us, would you?
Certified home health aides can do all of the activities of daily living. They provide dressing, grooming, bathing, all of those tasks that need to be done on a daily basis. They can administer medications. They can do other delegated tasks such as helping with exercises, simple dressing changes, and then registered nurses supervise that staff to make sure that all their care needs are being met.
You know, I think about elderly friends and friends who have issues that need some help, and being in your own home is really, really key, isn't it? And Libby, I know that your aunt is someone that has received this care. Tell me how this has worked for you and why you came to this.
Well, my aunt was 89 years old when she suffered a severe stroke, and she'd been independent up to that point in time, without children, and when she was presented with the alternative of spending the rest of her life in a nursing home, it was just devastating to her. And Homewatch provided her with the opportunity to be home, back in her own home again, and where she remained for 5 years until her death, with 24-hour-a-day care, because she needed lifting, feeding, everything. But
and she needed company.
Yes.
She needed someone to be there. Now, we're seeing just a little example of what some of the home care is like that you provide. They're playing cards and doing all sorts of things. Because in your case, Libby, with your aunt, her mental capacity was excellent. So she knew that she wanted to be in her home. She just physically couldn't do things for herself.
Exactly. And they were there all the time to provide whatever she needed. And she knew she had the security that if she needed someone, they would be right there, as opposed to putting on a call light and waiting and not knowing and feeling so out of control of her life. And this gave her as much control as she could possibly have.
Well, and we were talking about earlier that she could have a lot of visitors come over because someone could answer the door and someone could entertain a little bit. And
she probably had as active a social life as she'd ever had because of that. And people were not intimidated by coming to her home, where coming to a nursing home, people just didn't feel as at ease as they did. So she was quite active and on the phone and visiting.
Right. Sounds like a great solution for you. Judy, let's talk about who is and is not a great candidate for this service.
Almost anyone is appropriate for home care. Sometimes it means making a few adaptations to the home, like putting grab bars up in the bathroom for safety, or as much as converting the dining room to a bedroom with a hospital bed. But most people, just the fact that they're able to stay home, those little sacrifices are minimal to them. And all of their care needs can be met. We can do everything you can do in a nursing home, but it's in an environment that you're comfortable and familiar with, and it's one-on-one care.
And I suppose you just want people, as you say, to call, set up that consultation, and just talk it through with you.
Yes.
Because you're going to really know what does work and what you can provide.
Absolutely.
It sounds like a great option to me. Thank you so much, and thank you for coming in, Libby, and
My pleasure.
giving us your story. Homewatch Home Care serves the greater Twin Cities area and much of the southern Minnesota. For more information, you can call 763-546-8899, or you can call 507-388-5589. You can also go online to homewatchmn.com.